So let's start the answer of our first musculoskeletal case, giant cell tumor of the tendon sheath. I've put plantar fibroma as a differential diagnosis of the giant cell tumor, as I've noticed that some of you answered the case as fibroma. So let's see the main differences of the giant cell tumor and the plantar fibroma in the region of the foot. Okay, so this is a radiograph of the ankle joint, okay, showing an opacity anterior to the ankle joint and deep to the subcutaneous fat, and also deep to the extensor tendons of the foot. This is a giant cell tumor of the tendon sheath. However, this is a foot X-ray of plantar fibroma. Can you see here? There is localized thickening. There is localized thickening of the plantar fascia. This is how giant cell tumor is seen on the MRI sequence. Okay, so there is a well-defined soft tissue mass located anterior to the ankle joint or anterior to the tibio-talar joint, okay, and is seen deep to the subcutaneous fat and deep to the extensor tendons of the foot, deep to the fat and deep to the extensor tendons of the foot. The mass displays intermediate signal on T1 weighted sequences. Okay, here's the intermediate signal of the mass on T1 weighted sequences, and low signal on the T2 weighted sequences. Here's the low signal of the T2 weighted sequences, and here's the mass seen anterior to the tibio-talar joint. Here's the talar dome, okay, and if you go just, yeah, talar dome, and here is the tibia, okay, tibial plateau and talar dome, and here's this is the medial malleolus, and this is the lateral malleolus of the fibula. Okay, and here is the mass of low signal on T2. So the mass of intermediate signal on T1 and low signal on T2. And here's the characteristic high signal of the ganglia of the giant cell tumor on the T2 on the proton density image. So giant cell tumor on proton density image will show high signal. However, fibroma will show low signal. Fibroma will show low signal on all MRI sequences. However, giant cell tumor will show high signal on the proton density image. How to know that this is a proton density image? Can you see the float signal is bright? Okay, and the cartilage signal is gray. So this signal will help you to delineate the cartilage signal and identify any abnormality of the joint cartilage. Okay, so here's a mass of high signal on the proton density images. This is a giant cell tumor. Okay, and on the post-contrast sequences, the mass will show avid enhancement on the post-contrast sequences. Okay, this is the avid enhancement of the mass. However, in plantar fibroma, okay, this is a plantar fibroma, you will see a soft tissue mass, okay, a soft tissue nodular mass seen related to the plantar fascia. This is the plantar fascia, okay, related to the plantar fascia, okay, and it seems just beneath the skin marker the skin marker is placed, okay, exactly at the area of palpated mass, okay. So it turned out that this mass is related to the plantar fascia and shows intermediate signal on the T1 weighted images and intermediate to low signal on the T2 weighted images and shows post-contrast enhancement. This is plantar fibroma. So it shows the same signal of the giant cell tumor. However, if you perform proton density sequence or if you check the proton density sequence, plantar fibroma will show low signal also. Okay, so this is the this is the management of the giant cell tumor and the management of plantar fibroma. So in giant cell tumor, okay, surgical excision is the mainstay of treatment because the mass is seen exerting mass effect, okay, here at the joint and the tendons here, okay. So this mass needs to be surgically excised, okay. This is the mainstay of treatment. However, in plantar fibroma, there is a high rate of post-operative recurrence. That's why we need to start with conservative management first by modifying the footwear of the patient. Start to modify the footwear of the patient because the main complaint here will be pain at the plantar aspect of the foot, okay? So you need to start with conservative management and you need to only excise the lesion in very symptomatic patients, okay? And you need to excise the lesion if the lesion is very large and cause pain to the patient, okay? And you need to know that there is a high rate of post-operative recurrence, okay? So I think that's all, and thank you.